So welcome everyone to today's speaker series Thursday. We are not going to have a speaker, but we're going to have two 15-minute vendor spotlights. And so unless there's burning questions, we will start those. Let me go back to the people. In case anyone wants to get in. Rachel, are you going first? Is that what Paul had? I have you first on the list. So there's Dose Health and Claire's Healthcare are here. And Rachel, we want to take away your presentation from Dose.
Awesome. I will get started. I'm just going to take over and share my screen.
Please do.
Okay, so we are Dose Health. We have two primary service lines. I'll cover our first one because it's more unique than our second one. So overview, we have a smart medication dispenser as our sort of primary service. The second one is our personal emergency response buttons, and I'll go over those second, like I said. I'm going to save probably a little bit more time for any questions, primarily because our medication dispenser is pretty customizable to whatever your individuals or beneficiaries would need. This is what the device looks like. It is not true to size, obviously, on our website. It's about the size of a little bit bigger than a standard bagel. Regular setup has about a week's worth of medications that would be set up for 2 times a day. Its primary function is to give the right medications at the right time. So once those medications are programmed into the device, it will rotate itself open. It's going to alarm and flash, letting the individual know it's time to take their medications. At that point, the individual is simply going to flip the device, and those medications will flip into their hand. They can flip them into a cup. Otherwise, depending on their needs, we also have a couple of adaptive equipment pieces that would help them flip those medications. And so I just got sidetracked by the comment. So thanks, Baxter, for that. He had just said that the medication, they love it. So once it flips, there is a video on our website that will show kind of how it works. And so once they flip those medications, like I said, the medications are essentially dispensed. The device closes itself up, puts itself back to sleep, and will not wake up again until it's next med time. If the individual misses the first alarm, there are 2 other alarms built into the device. Those alarms go for the full 2-hour med window. The second loudest alarm goes for every about 20 seconds or so. The goal, obviously, is to get that individual to take those medications. So that alarm is a little bit annoying. The way to get the alarm to stop is obviously to flip and take those medications. So those are the primary physical features of the device. But also built into the device is a cellular chip, and that chip allows the device to store and send data. And so for any individuals who are in a setting or working on their independence with their medications, a phone call or text message can be sent to a provider, to a family member, to any other support if those medications haven't been taken yet. And so let's say a med time starts at 8 a.m. If at 8:30 those medications still have not been taken, a text message can go out or a phone call to say, hey, Jill's medications are still waiting to be taken. And that way there's still time for an intervention. If at the 2-hour mark a client hasn't taken those medications, that device closes up and the medications are marked as missed. That would be the other feature of the device, and that's the stored data from the device. And so at any time, anyone can pop into what we call our dashboard and be able to see the device and sort of where it's at. So I have a quick example of what that dashboard looks like. And so this is a simple version of the dashboard. And so if you're supporting a handful of individuals, you would see each of their devices here and be able to see sort of what's happening. If a person did not take their medications, these letters would be red, meaning that the medications have been missed entirely. I'll pause there for any sort of quick questions on the medication dispenser.
Rachel, this is Kathy. Can you tell me,
Yeah.
like, who is filling these dispensers?
Yep.
So we work with individuals with intellectual and developmental disabilities, and there are certain rules that we have to live within. And our direct care staff would not be able to fill those dispensers. So
Mm-hmm.
how are you doing that?
In the bulk of our other states, it's either home health agencies that are already going into an individual's home doing other tasks that are filling the medication dispensers. And that can look a variety of ways. So if they're already going in weekly, that works. Otherwise, we have extra trays and some other things to help make the refilling process easier. In some of our other states, depending on rules and regulations, there is the potential that some pharmacies will help us fill the trays which go into the device. And so it really just depends on each state, and sort of like you had mentioned, Kathy, those rules and regulations around who is filling. It varies drastically. Sometimes it's family members. I have a handful of clients that are working towards their independence in filling. And so they're filling, but they're filling with the oversight of another individual who is capable of filling.
Okay, thank you.
You're welcome. Any other questions? Okay, the device is also fully portable. And so we have a travel case. The device can be taken with people. Battery life is about, I would say, 2 to 3 days. It's a regular micro USB charger. And so we always just recommend keeping a charging cord with the device. Much like all of our devices, right? You never know when it's going to die. So we just recommend always having that charging cord with it in the event that it is dying. A handful of our services include, because it's a subscription model, we've chosen to go the subscription model primarily because one, our device is portable, so they go missing, they get lost, they get broken. We had an individual using it as a coaster for a little bit, in addition to it dispensing, and so that one got pretty yucky. And so we have free replacements for the lifetime of our subscription. Just give us a call, which leads me to my other sort of unique aspect of our service is that we have 24-hour support. And so we can do a lot of remote troubleshooting of our device, whether slots get off, the lid comes off when it shouldn't, some of those sort of regular troubleshooting things that you just wouldn't get if you're buying a device outright. And so you're really purchasing a service versus just a physical device. And that 24/7 support, phone call, text message, email, whatever that looks like for an individual or a provider who is supporting an individual using that device.
I have a question. This is Lynn, and I'm with the Division of Developmental Disability Services through DHS.
Yeah, hi, Lynn.
Hi. So I have two questions. One of them is, how is this connected? And you may have said it. So is it connected like by Wi-Fi, or how is the data, how's the system connected? Because we have a lot of participants on our waiver program that live in rural areas and who do not have said service of, Wi-Fi. So that's my first question. The second question is, this is connected to provider agencies as it relates to, like Miss Kathy said, our DD population. So are providers able to print the med logs and the, when intake was, or, if they taked it, the logging of it, are they able to print that data out and like put it in their files, or if they need it, be able to retrieve the data? So those are my two questions.
Okay, so the first question is a great question, and also part of the reason why sometimes our service doesn't match what an individual needs. And so our devices have their own SIM card. So much like your cell phone, the device has its own sort of connection to different cellular towers. And so what we'd want to explore is whether or not the device is able to connect in some of those rural areas. In almost all of those cases, if there's a question of whether or not the device is going to be able to connect, we would set up what we call a trial. We send out the device, see if we can get that connection. Sometimes it's just a matter of where the device is located. The device still functions without the cellular connection, but obviously without the cellular connection, we're not able to get that data. But that would be, we'd want to try it out and see what that looks like as far as a connection. But it carries its own SIM card, basically its own phone number to connect or ping to the various cell phone towers in the area. And then to answer the second question, so you really wouldn't necessarily be able to print from the dashboard per se, but one of the other pieces, because we can store and send data, is we're able to create what we call a monthly adherence report. And this is likely what you would be attaching to your client documentation. And that's just this. So this is my own. I had to go back several months because I have fallen off my medication train as far as using my device. But this is really what it would look like as far as what you'd be printing or what you could be putting in that individual's chart. And this really highlights the adherence for the month as well as the greens and reds. We can break down each month even further. And so if you wanted to see on this green on the 8th, we can pull very specific data on when those were actually dispensed as far as a timestamp. And so really it's just going to depend on what you need for your documentation and how we craft this report. This is something that I do for all of my case managers. We have an individual in Minnesota who runs these reports for Minnesota's residential settings. So not anything that you would have to manually do. We would be taking over the work of that and sending it monthly out to you. And then you would just be printing it and putting it in that individual's chart.
Okay, that's great to know. I have a follow-up question
Sure.
regarding the data part of it. So you stated that you guys are able to like go in and customize the requirements of the data recorded, and so provider agencies could like use it. So is that just a universal customization, or is that like a provider agency individual customization? Like one provider may need this information, but another one may need this. And I mean, is it just a general one, or is it like able to be independently per each person?
I think I'll say both to that answer. So we can customize per provider, but within that customization, right now there's only a set amount of data points that we can pull. And so if you need something very specific that we don't have readily available, that might take us just a little bit more time to work with our IT to be able to pull that data in. But really our goal is to customize these reports for what you need or what your provider needs to be able to do their job.
Thank you.
I think there might have been another question.
Yeah, Bridget, did you have your hand up? The hand went down.
Okay. Any other questions on the medication dispenser? Okay, I'll jump quickly over to our PERS because I realize I just have a couple minutes. Our PERS are our personal emergency response buttons as well as GPS. Relatively standard for the market. What generally sets us apart in our PERS category is we have no install fee and also no equipment fee. We have just a monthly subscription that we are using, and that's $45 a month for our devices that have GPS or fall detection. Again, we'll work with individuals to really figure out which one meets their needs. But because they're all $45 a month minus our standard button device, If an individual starts with a Bell X and decides they want to transition to a Stride watch, it doesn't require any extra authorization or anything like that. We just swap those out for the client and then let any individual know. GPS options are a text to locate, just sending a text message to a specific number, and it comes back with a Google map. The Bell X has an actual application where you would be able to see live GPS mapping of where the device is, in theory, the individual who has the device on. These all go connected to a monitoring center who's able to triage. We're able to set up the account behind the scenes in a variety of ways to help the monitoring center triage, which basically means the call doesn't always go or result in first responders. Any quick questions on our PERS or ERS, depending on where you guys are? Excellent. I think this is the first time I ever stayed within my time limit, so
Yeah,
I'm
you did
feeling
great.
really proud of myself.
You did great. You did great. Is that everything, Rachel? Is that any other questions? Okay. All right. And before we start, I'm going to stop that recording, manage recording, so that Paul is happy with me. I am stopped.